The purpose of this video is to provide deeper insight between the intersections of the housing and healthcare systems as it relates to parents and their children, greater understanding of the lived experiences of people who have gone through pregnancy while dealing with housing instability, and action-oriented recommendations for policy and practice change that you can implement. Voices of people who have experienced housing instability while pregnant are the best guide for recommendations for change in housing and healthcare systems. You often don't see what someone has dealt with before coming into your office or organization.
I think just being more supportive and finding something that can fit them, that without having all these stipulations on it, because that's what holds people back from being able to get housing for themselves and their children.
Consider what people have gone through or why they are where they are. Not everybody that goes into the hospital that's addicted to drugs was always that person.
Ariana is a mom of two from Albuquerque, New Mexico. She was unhoused during her first pregnancy and had to do whatever she could to survive. After giving birth, Ariana lost custody of her daughter and was incarcerated.
Honestly, when I think of the government, I think of how they use people's backgrounds so hard against them that prevents people from making changes in their life and also making changes in the world. People who have done things in their life can be some of the biggest influences, and they prevent us from being that by putting so many stipulations on who we can now be as a person.
I think the expectations of having to make 3 times the rent and having to have good credit and having to not have bad rental history just to be able to have stable housing for yourself and your children is something that people should look more into. It's not safe out there on the streets for children to live, or pregnant people to live, or parents to live with their kids.
Providing housing and income during the entire perinatal period protects young parents and their children. Many parents also deal with high stress and poor mental health. This is particularly true for parents who may not have a strong support network, including people who are living in unstable housing situations and those experiencing homelessness.
Having a maternal child health hub where all the resources is in one place is beneficial for a community because it's like a recreating of home. Shelter, medical, food. If you had that all in one place, it's like being at home.
Destiny is a mom of two from Indianapolis, Indiana. She lived in a shelter after giving birth to her first child. Her child's father was not allowed to be at the shelter due to restrictions on gender.
I feel like the systems fail me as far as the shelters go with keeping families together. I just didn't feel like I was protected enough as a first-time mom.
Keeping families together through community-based support can be life-changing. What Destiny and Ariana went through is not an anomaly. There are parents across the country experiencing difficulties navigating the housing and healthcare systems every day.
Policymakers should know that there needs to be more sharing of information, make connections with the health systems to say, hey, when they're at that prenatal visit, let them know there's housing things available, there's food available, there's, health insurance available, there's mental health available.
Some people don't need prison to change their life. Some people don't need a hard sentence. Like, some people just really need some compassion for what they've gone through and an example of like how to change and how to be a better person.
Whether your work is in policy, housing, or healthcare, it is intersected for so many parents and their children. You could be the person to change someone's story. Learn more about the recommendations you can implement in your work at housingequityframework.org/system design.